My name's Randy. I have been in the wellness business for some time, and I never thought I'd be a patient, but my knees end up starting bothering me. And then I went skiing last Christmas, and my right knee just completely was aching. I didn't have an acute injury, so I know I didn't need to see a physician, but I just felt like there was some degeneration going on there. And living in a 3-level townhouse meant that going up and down steps was just becoming painful. I'm used to being an avid cyclist. I am an avid skier, and having knee pain to where I could barely get up and down the steps was becoming bothersome to the point where I knew I needed to do something. I am familiar with stem cell therapy. I had been familiar with it, but I had never really researched it. So I did quite a bit of research. I was looking at all of the offshore places from here in the States. I live in Florida. I looked at Costa Rica, I looked at Panama, I looked at Tijuana. TreVita stood out. Number one, their pricing is attractive, but their website and the professionalism of the people I spoke with prior to making my appointment really helped convince me that it was the right choice to make. I had been looking into other therapies prior to the stem cell therapy. I am involved in peptides, and there's a number of regenerative peptides that people use for soft tissue repair. I was doing those and have been doing those actually for some time, and I've had success in the past, but these just were not affecting my knee function. My knee, it literally was feeling like it was on fire, and I saw a therapist down the street, and he was doing some percussion therapy that he thought was going to do some good, but it just made it hurt worse. Finally, short of going to a surgeon, and if you go to a surgeon, they're going to recommend surgery, and I don't want knee surgery. So I started looking into stem cell and saw some of the results that were posted and felt like, well, not only am I looking forward to having a more healthy and stronger knee, but the rest of the benefits of STEM as well, I think really should be beneficial for me. So that's what convinced me to go down the stem cell route. TreVita finally appealed to me best, so I made that choice. And I'm glad I did. It was a very easy decision to make, easy to have the procedure done there. It's now about 3.5 months later. I've got full range of motion. I am 100% back to my normal activity. I'm cycling, going up and down the steps just like nothing. I don't think about my knee. And I would say the stem cell benefit is far beyond my knee, because in my cycling, even though I was off for about 6 months due to my knee being so sore, I'm back now and I'm breaking some personal records on some timed laps that I make. So I'm very pleased with how things are developing. After about 4 weeks, and they said, works on inflammation first. So after about 4 weeks, all of a sudden, it was feeling better and I was gaining mobility and range of motion. And really, after the next 4 weeks, my knee was feeling probably 80%, and now 3.5 months, I would say I'm probably 98% back. I mean, aside from just a little bit of tenderness, my knee is perfect, and I am cycling like crazy. That first 4 weeks, I thought, well, gee, it seems like nothing happened, but then it really does kick in, and I guess kick in is probably a great way to describe it, because you wake up one morning and you're not thinking about that knee, and I go down the steps and all of a sudden I get to the bottom and say, well, wait a second, my knee wasn't hurting. And then I thought, well, I'm going to go for a bike ride and see how I do. And then next thing you know, once I get that motion going, my knee wasn't hurting through cycling. And then I just feel like the rest of the benefits of STEM kicks in with it. I have a 16-mile loop here, and I had never been under 1 hour in that loop, and now I'm at 56 minutes. So I'm really pleased with myself. And I'm 65. I shouldn't be performing so well cycling over, my previous record. So I'm really happy with it. I would say that compared to any less expensive options, there is no comparison with TreVita, anything less expensive. You guys, I really like the location, to be honest. I did quite a bit of research. It's literally a stone's throw from the border, and the airport to door service was completely wonderful, professional, fast. The proximity to the United States really helped kind of convince me that TreVita was a good place to go, because I thought, well, if there's any problem at all, then an American hospital is like a half hour away. I think it's a very easy flight for anybody in the United States to get to San Diego, and you're in Tijuana in a blink and you get your treatment done, and it's less expensive than many, and it's fast, efficient, easy, and everybody's a pro. I'd never been to Tijuana before, and knowing that TreVita was in Tijuana, yes, I used Google Maps and Google Earth and saw where it was and the proximity of the medical center to the border. And that gave me comfort. But I will say, once I got there, it was a beautiful hotel. It's a beautiful hotel. There's an outdoor restaurant gathering area there, and I ate at this outdoor restaurant twice. It was magnificent. In the evening, I actually left the hotel and just strolled across this huge tree-lined Broadway. It was really quite nice. At no point do you feel like you're in a dangerous area. It's actually quite scenic, quite beautiful. The view from the office while I was getting the IV, I have pictures from out the window. It's like this beautiful vista, this rolling hillside, and it was great. There's no reason to feel like it's going to be dangerous at all. It's just a regular city. Post-care, TreVita really does follow up with you. They continue to reach out and ask for feedback and ask how you're feeling. It's 3.5 months later and we're talking. So they keep after me, which is good because now it's working. So I'm happy to talk about it. I would say for anybody that's hesitant about getting into stem cells, surgery is always there as a last resort, but it really should be a last resort. If you went to see an orthopedist and he said, oh, well, we need to operate on your knee, well, that's because that's what he gets paid to do. He doesn't get paid to tell you that might be better ways to heal that knee. The value for your money is incalculable because I have my original knee in my knee. It's not a fake knee. I don't have any doctor telling me that I shouldn't do this or shouldn't do that. I'm literally able to do every single thing I've wanted to do since my knee's been feeling better in the last month and a half that I've done all along. And I look forward to feeling more of the improvement of the stem in terms of my physical conditioning and physical capability. And I know that if sometime in the year or two, I feel like I'm getting old because I am 65 now, I might just go ahead and get another dose of stem cells over there at TreVita because, I know it can't hurt. And for whatever is going wrong, I think it's going to help me. So I think it's a good thing.